Hi friends, as part of our Disability by SAMVAD series, today I am going to talk to you about common mental health problems that occur in children with developmental disabilities. Developmental disabilities are a group of conditions that start in the early childhood and they exist across the lifespan of the individual. And these conditions include intellectual disability, autism spectrum disorder, attention deficit hyperactive disorder, etc. And these conditions are not illnesses, they are conditions that happen due to the altered brain development, which is initiated in the very early childhood period. And children who have these developmental disabilities usually have developmental delays in developmental domains like gross motor, fine motor, speech and language, socio-emotional and cognitive domains. And they also, because of this developmental delays, they have significant impairment of their day-to-day functioning, and they require support of the parents or caregivers in their activities of daily living. Children with developmental disabilities are at increased risk of mental health problems. This is because the developmental disabilities in itself are caused in these children due to the altered brain development. These brain development issues can precipitate the mental health problems in interaction with various psychosocial stressors to which these children are more vulnerable compared to children who have a normal or neurotypical development. Mental health issues in children, they impair the functioning in a child who already has developmental issues, that is developmental delays. Either it could be a gross developmental delay involving all the developmental domains or specific developmental domains delays, as we see in children with conditions like speech and language impairment or autism spectrum disorder. So the mental health problems, they lead to additional impairments in the functioning, putting a significant burden on the caregivers in providing the support or care to these children with developmental disabilities. The mental health problems in children with developmental disabilities are often missed during clinical evaluation. Parents or caregivers have to be alert about some of the warning signs to detect and identify these mental health problems at the earliest, so that early intervention can be provided to these children with developmental disabilities. Some of these warning signs are exacerbation of the functional impairments that have been pre-existing due to the developmental disabilities, onset of any changes in the behavior abruptly, onset of changes in the sleep pattern or feeding habits of the child, behavioral symptoms like aggression, withdrawn behavior, clinginess to the parent, crying spells, etc. Also, in the case of children, when there is any recent change in the daily routine or any recent psychosocial stressors, it's more likely that these children can develop the mental health problems. So parents have to carefully watch out for these warning signs, and if they notice that the child seems to have developed a new problem, definitely the child will require a thorough evaluation at that point of time. The mental health problems have to be identified at the earliest, and immediate consultation with a mental health professional is the right thing to do. A mental health professional during the process of evaluation will collect a detailed history from the parents and the parents or caregivers of this child, and as part of the detailed clinical evaluation, there will be a direct behavioral observation of the child. at least over few sessions, not just one session, at least 2 or 3 sessions. And at times it may require even evaluation for a brief period in a hospital setting where the child could be admitted to exactly identify the co-occurring mental health problems in the child. So once this is done, the management of these problems will be planned by the treating mental health professional in consultation with the other experts in the multidisciplinary team, and this will be done as a collaborative work with the parents and caregivers. So, in the home context, parents they often find it difficult to provide care for children with developmental disabilities with coexisting mental health problems, because the mental health problems bring along the additional functional impairments along with the already existing functional impairment in children with developmental disabilities. So when they have to manage these problems, it's important for them to identify the exact issue or problem. Say for example, if the child is having aggressive behavior, the parent has to carefully note the frequency of the behavior, intensity of the behavior, and also whether there are any antecedents of this behavior. So antecedents means whether anything just happened before the child started behaving aggressively, and also to see as to how long this behavior lasts in the child and what are the responses that can ameliorate this behavior or can exacerbate the behavior. And along with the mental health professionals, a close liaison that is established in a collaborative way by the parents to learn the behavioral management of these concerns in the home context will help the parents to manage many of these behaviors. There are times where the child will show emotional problems along with the behavioral problems. So the child may show significant negative emotions like sadness or anxiety, etc. So the parent has to maintain a diary of these emotional changes that happen during the daily routine of the child, and also the factors that can influence these emotional issues in the child, and how their response is either increasing or decreasing these emotional behaviors. And with the help of the mental health professionals, they can learn how they can teach the child regulation of their emotions in the home context. Similarly, the same principles can be applied by the other caretakers outside the home context, in schools and other settings where the child can manifest some of these symptoms of the mental health problems.